Hello everyone. So, this is also again a part of first aid training where you have to manage the emergency scene. The emergency may have been caused by a vehicular accident or a natural calamity or any other dangerous situation might have arisen. Emergency scene management is a vital skill for all first aiders and first responders. So, the first aid volunteer who reaches there first time, he is the person who can manage the emergency scene properly. The safety of rescuer is the first priority. First of all, you see your safety. Do not jump into the fire or jump into the gas leaking scenario or jump into the mob people who are aggressive and throwing stones or hurting each other in any emergency situation. So, care in approaching the scene is critical. Be alert to the hazards which are obvious. Example is fire, smoke, fallen power line, hazards which are hidden. Here smoke which may not be visible or electrical power line which has fallen, you may not be able to see the current inside, but this you should be able to judge that this is the situation and I should avoid going inside that situation. A needle under a casualty or hazards which may develop, a change in the weather, movement of a vehicle or a structure, a fire which is out of control. So, these are the situation. First you have to see your own safety. It is important to confirm that emergency services has been notified. First of all, inform the emergency services, and first responders may not be able to approach casualties if the hazards are very dangerous and it is not safe for you, then you may not able to reach the emergency scene. So, in that case you inform the emergency services and try to do whatever best possible. You will need to take a leadership role in case of emergency services because you are a trained volunteer. So, first of all, stay calm, act sensibly and responsibly. It is your responsibility. You just cannot take a random decision and do whatever you want. You are very aware of what is happening around you, help to make the situation better and not worse, and ensure the safety of everyone involved, not only you, but suppose other people also trying to get into that fire or a smoke, prevent them and tell them to be away from the situation. You are a resourceful. By the time you reach there, you prepare your team. Stay within the boundaries of your own training, qualification and skill. Whatever knowledge you have, that only you exercise, not beyond that, and keep control of emotions and personal views. Concentrate on what needs to be done. So, your focus should be what you can do to improve the situation and not to worsen the situation. Ask other people to help and direct them in what they can do for you. So, first and foremost is assessment of the scene, identify the hazard, what is causing hazard like fire, smoke or electric current or a mob or a burnt into the vehicle which has caught fire because of accident. Assess the risk, identify potential causes of injury. In such situation, what injury could have happened? Suppose in presence of smoke, people are likely to get asphyxiated. So, the first and foremost problem you will find is people are not able to breathe. Identify likely type and severity of injury and choose the most appropriate responses and resources. Then you accordingly you can decide how you are going to help them. Hazards and dangers that may be present include biohazards, leakage of the gas from a chemical factory, chemicals, corrosive agent, spilling of the corrosive agent usually happens in lab, fire, inflammable liquids or gases, smoke or dangerous fumes, electricity and power lines, rising or fast flowing water, submersion in the water like flood, tsunami, vehicle traffic, many vehicles collided with each other and causing block of the traffic as well as injured people inside the vehicle. Falling objects, unstable structure, usually this happens in earthquake, slippery surfaces, sharp edges, explosion because of bomb or any other fire or anything, bullets, confined spaces. Sometimes everything happen inside a closed room or a closed boundary of a space, heights, people something happen at the height, glass sharps, people aggressive mob, armed with weapon, uncontrollable, extreme anxiety and stress. So, first of all these are the dangers where you have to judge the situation and then decide your action. This is the picture of the road accident where a car has been collided with another vehicle. In the case of a road accident, ensure that the ignition switches of all vehicles involved are turned off. So, first of all whichever vehicles have collided, the ignition switches are turned off. All casualties are moved to the safe when if practical and possible. When if you are able to open the door of the car, then it should the victim should be moved to the safer place. But many a times you are not able to open the door in this automatic cars and all, then in that case you have to get the help of to cut the car doors and bring out the casualties. If there is any indication of spillage of dangerous substances including petrol, then emergency services must be notified. Try to keep yourself and all bystander upwind of any potentially hazardous vapors or other emissions or release. In suppose in case of smokes and all, you keep the bystander as away as possible, because they may not be knowing that this is dangerous or potentially dangerous to their health. If a vehicle is upright, try to immobilize it using hand brake and place blocks under the vehicle wheels. If a vehicle is on its side, do not attempt to bring it upright. It is not your job and it is not possible to do it also sometimes. Emergency action steps in first aid. The following are the first aid steps to take in case of an emergency. Ensure that both you, first of all your safety, then your victim safety. So, as far as possible you ensure that you entering into the emergency scene is a safe. Secondly, whoever victims you see, try to move them out from that unsafe environment of emergency scene. Check for any response from the victim, shake them and shout to determine whether they are responsive or unconscious. First of all, shake and shout whether they are responsive or unconscious. So, if unconscious only, give recovery position. If not responsive, and check the pulse and breathing. If there is no pulse and breathing, then give CPR. But never leave the victim alone. Call for help or assistance. If you are the only person with the victim, then you prepare somebody from the crowd or somebody you know to come and help you out. Quickly assess the condition of the victim, check their breathing and if they are unconscious. Check if they are bleeding or if there is a presence of life threatening condition. Suppose they are bleeding from somewhere, very massive blood loss, then you should act accordingly and this can be life threatening. Begin chest compression if person isn't breathing. Place them in side recovery position if they are breathing but unconscious. and if they are bleeding, apply direct, first of all try to apply direct pressure or control and stop the bleeding. So, three things: unresponsive and breathing, recovery position; unresponsive and not breathing, CPR; and unresponsive and bleeding, then give pressure on the bleeding site and try to stop the bleeding. Do not allow people to crowd around the victim, keep everybody away. So, victim can have a fresh air, you have enough space to deal with the victim. Do not move them unless you absolutely have to, such as if the area becomes unsafe. Assess the area and the victim's condition and try to stabilize the victim with the resources and services present in the area. So, whatever is available with you or in that area, you try to stabilize them. Frequently asked questions in emergency scene management. What do you do in an emergency first aid? Some of the things to do in emergency first aid are: keep the victim still and warm. First of all, make him comfortable, keep him warm, keep assisting and reassuring. If patient is victim is conscious, talk to him, reassure him that now everything is available, I am here, some people are there to help you, medical help is arriving. So, assurance. Check their breathing and provide them with rescue breaths if needed. What are the 3 C's in the first aid emergency situation? The 3 C's in first aid emergency situation is check, call and care. First of all, check the victim for unconsciousness, unresponsiveness, for breathing, etc. Then call the emergency team and then start caring to the victim by giving recovery position or by giving CPR or by giving pressure on the bleeding site. What are the ABC of the emergency management? But we have learnt, now it is CAB. So, first is compression, then airway and then rescue breath. So, this is the way to the unresponsive victim who is not breathing. Why is checking the scene so important? The reason is not so important to check the scene is so that you can ensure that there are no dangers in the environment around the victim. First you check everything, that what has happened, what has caused this victim to become unconscious. So, by checking this you can make yourself safe as well as victim safe in the environment. What are the 5 types of first aid? 5 types of first aids are CPR, bleeding, burns, choking and broken bones. So, for each and every scenario we have learnt in our lectures how to give first aid. Whenever there is an emergency, be it on the road or even within someone's home, it is important to act immediately. You just cannot just delay your getting into the scene and assessing the scene, as one does not have the time to research the next step to take. This is why it is so vital to learn about the emergency first aid steps, so as to keep your loved ones safe and help strangers if needed. And by doing your research in advance, so in advance only you should know that if it is a smoke, these are the steps I will take. If patient is victim is unconscious, this is the way I will react. If there is a fire, these are the steps I need to take. So, keep everything, your kit and your thinking process in place before you enter into a emergency scene management. First of all, stay calm and collected and do not let your emotion get in the way of help. Sometimes you may become very much frightened by seeing the scene and sometimes dead bodies and lots of blood coming out of a victim and also. In this case, you do not get emotional, you have to stabilize yourself and act. No matter what the emergency is, simply keep your cool and let your critical thinking skills guide you towards the next step to be taken. What are the steps needs to be taken? for emergency scene management. Any emergency, including a medical emergency, the best response is to prepare with the emergency scene management steps. In organizations, management needs to make sure that in case of medical emergency, the first aiders are trained through an accredited training provider, which will enable them to confidently manage first. So, this in any organization, if there are if staff is given first aid, they should be trained by a accredited training provider. So, they have confidence and they learn exact steps and very right steps. In any emergency situation, first thing you need to do is the assess. First is assessment of the scene. What is the problem, how it has happened, how many victims are involved, what is the status of the victim and all such thing. Remain calm and assess the scene. Again and again we are stressing on this point that do not get your emotion in the way of your services and remain calm. Check for hazards and provide a safe. Second step is check if there is any hazard because of fire, stroke, because of fire, because of smoke or because of any other like tsunami or flood like situation. So, check the hazard and first of all keep the environment safe by shifting the victim and shifting yourself away from it. Third is then you assess the casualties condition and provide first aid as necessary. Then you assess the victim, shout, shake and check for breathing, right. So, if whether patient is responsive, unresponsive, conscious, unconscious or whether patient is victim is breathing or not breathing, whether victim is bleeding. These are the things you have to check first, because these are the emergencies which has to be managed first. Here they are trying to check the casualties condition by shaking, trying to check whether the victim is responsive or not. At the same time, you call the emergency services and provide the information. You may take help of a other bystander or a properly educated or some volunteer who is trained volunteer and tell them to inform the emergency services and give them proper information that what is the situation. This emergency scenario has happened because of what? Because of the injury, accident, because of some natural calamity, because of some dangerous gas leaking and whatever. So, it is important for the bystander to report back to the first aider and confirm that medical assistant is, and confirm that the emergency assistant, medical assistant you have called has likely to come as early as possible. And by providing all information, the medical team will decide what are the equipments they have to bring along and whether to bring AED, automated electrical defibrillator or other first aid related equipment. Stay with casualty until medical help arrives. Your duty is to stay with casualty victims and make them as comfortable as possible and help them. The first aider must monitor. So, even if the casualty is breathing, conscious, but still you have to keep monitoring every 5 minutes and keep the record if possible. You must also be prepared to start CPR while you wait for the paramedics. So, sometimes initially victim may be breathing, may be conscious, but after 5 to 10 minutes his condition may worsen because of some bleeding inside the body or sometimes some foreign body getting stuck into the airway, or sometimes because of vomiting following the injury and also thing, then condition of the victim may worsen. So, you keep monitoring them and keep checking them every 5 minutes. If time allows you, you take the sample history. Sample is sign and symptoms, what has happened to them, allergies, medication they are taking, past medical history, last meal they had. This is very important, because if they had meal immediately in recent past, then they are likely to vomit. In this case, you have to be prepared for the, if any vomiting or anything happens, and events leading up to the injury or incident, what exactly happened, so that such a emergency situation arose. So, an absolute health services, we do not just offer first aid training, we can train all emergency team members in first aid, firefighting, evacuation planning, and this is higher type of training, where first aid providers are also trained in firefighting and evacuation planning. So, here stay with the casualty, monitor the casualty. This is the reference from which this presentation is prepared, and so emergency scene management. First of all, assess the scene. Second is safety, your safety and victim safety. Then assess the victim's condition, whether responsive, not responsive, whether breathing, not breathing, or whether there is any bleeding. These are the three very emergency things where you have to react very fast and help the victim to recover and minimize the time till the first medical professionals arrive for the help. So, in short, this was a emergency scene management. Hope you have learned something very basic about it, but for further service providing as a volunteer, you need to undergo a training or a proper course of emergency scene management. Thank you very much.